Hello, everyone. Thank you very much for joining us this afternoon and evening. I am your host for this webinar, Dr. Jessie Sanders. I am the Chief Veterinarian of Aquatic Veterinary Services, and I am a certified aquatic veterinarian through the World Aquatic Veterinary Medical Association. Today, we'll be covering a very important topic in the fish world right now. Today's topic will be Koi herpes virus for koi owners. In California, in the last 12 months, we have seen a resurgence in cases like this. We've actually had 3 cases already spread out throughout our own state, and I can imagine that there are many more out there that have gone unreported. So if you're a little unfamiliar with the GoToWebinar setup, there is a little question box all the way to the far right. If you have any questions during the presentation, please feel free to put your questions in there, and we will try to answer them at the end of the presentation. I don't expect this presentation to be more than about 15 or 20 minutes if you have somewhere else to be soon. So starting off, we'll be starting with what is KHV, Koi herpes virus? How is KHV transmitted? What are the clinical signs of KHV? What treatment is available for KHV? And how do I test my fish for KHV? So starting out with our first topic, what is KHV? Koi herpes virus is also known as cyprinid herpes virus 3. The 2 other cyprinid herpes virus are carp pox, which is cyprinid herpes virus 1, and goldfish hematopoietic necrosis virus, which is cyprinid herpes virus 2. KHV affects koi and common carp. The virus has temperature-dependent shedding and is shed most frequently between 60 and 77 degrees Fahrenheit, also 16 to 25 degrees Celsius. This is the main differential between KHV and another disease called spring viremia of carp. Both of these have very similar clinical signs, but have a different temperature range. Spring viremia of carp is at lower temperatures between 54 and 52 degrees Celsius, or 72 degrees Fahrenheit, which is 12 to 22 degrees Celsius. KHV has an incubation period where the virus is in an animal replicating. That can be 7 to 21 days, and this is going to be temperature dependent. At warmer temperatures, they will replicate faster than at colder temperatures. KHV tends to have a very high mortality rate, between 80 to 100%. We will be going over some of the other clinical signs in a little bit. KHV is an OIE reportable disease. However, it is non-actionable at this time. Depopulation or euthanasia of affected individuals is not required. And this is, again, very different from spring viremia of carp, which is actionable, and depopulation will be required. However, from some basic tests, it is fairly easy to differentiate between these 2 diseases. So that's a little bit about what KHV is. Moving on to how is KHV transmitted? So most commonly, transmission will occur with direct contact between infected fish, and this includes carriers. And this can also mean non-symptomatic carriers. So carrier species of this disease include other carp species, including grass carp, the crucian carp, goldfish and common carp hybrids, and other cyprinids. Keep in mind that carriers will never show any clinical signs. Koi and common carp can be non-symptomatic carriers. These are individuals that carry KHV and will never show any clinical signs. So this can be very problematic in ponds that have had an outbreak of KHV. Those individuals that survive known KHV attacks will be carriers for their entire lives. And that's just the way herpes viruses go. It's the same as chickenpox and shingles in people. The herpes virus resides in neurons within your spinal cord and other tissues and can never be completely removed. So that is why these carriers can persist for very, very long periods of time. Another common route of transmission is fluids from infected fish, and this also includes an infected environment. This can be water, so the water that fish swim in can be affected, carrying this virus. Also mud or the bottom of ponds. And other equipment and other vectors like personnel equipment, hoses, and even dogs that were, say, splashing between ponds. Now, I noticed that some people are having issues trying to get on here. I apologize for that. I am seeing everything okay from my end, however. So if you are having problems listening to this, I will make sure that all recordings are sent out after this has taken place. So no worries, everybody will be hearing this eventually. So following up with transmission, that would be fish that are affected carriers or other carrier species, fluids from infected fish and infected environments such as water, mud, and other fomites or vectors, including equipment and whatnot. Moving on to what are the clinical signs of KHV? Unfortunately, the clinical signs of KHV can be very nonspecific. So this basically means there are no clinical signs that will immediately point to a KHV outbreak. Death can occur in infected individuals showing vague clinical signs within 24 to 48 hours. So this happens very quickly. The most common lesions that we see as veterinarians are gill mottling, where you can see here the color switches between a very dark red to a very pale white. You can also see bleeding gills, sunken eyes, and pale skin patches, which unfortunately could point to many different issues in fish. So unfortunately, nothing is specific for KHV. Usually we'll be suspect of it when you have a lot of deaths in a pond within a 24 to 48 hour period. Other clinical signs include notched noses. However, this is not always the case. It is very common to see secondary bacterial, fungal, and parasite infections, like this ulcer here. And unfortunately, that's just due to the fact that the fish's immune system is compromised, and therefore they're not going to be able to fight off any other infections floating around in their ponds. You may see some behavioral signs as well. This includes a lethargic fish not wanting to swim, sitting at the bottom, an anorexic fish not wanting to eat, and respiratory distress, which in fish can either show as an increased respiratory rate or staying near the surface, air stone, waterfall where the oxygen is higher. You may also see uncoordinated swimming, where fish are bumping into the sides, other animals not able to grasp food correctly. So a lot of different behavioral signs that could be seen with KHV. So moving on to what treatments are available for KHV. Well, unfortunately, in this case, there are no treatments for KHV. Once a fish has it, it will have it for life if they do not pass away. So that is what is most important about KHV, is that this disease will persist for life. And that includes any fish that are carriers that will never show any clinical signs. Really, the only thing to do for this is prevention. So prevention is the only option to keep your fish from contracting KHV. And this means quarantine. So we recommend 4 to 6 weeks in a completely separate, isolated system. And this will be separate filtration and equipment. Since this is a waterborne disease, you have to make sure that water does not splash between the systems. If you've ever been to a koi show, you may notice that they have dividers up and between all of the tanks, at least they should. And this is really to prevent KHV from being splashed between systems. If you want more information about quarantine, our next webinar will be covering that, and that is coming up next Tuesday, March 13th at 2 p.m. We get a lot of clients that say they don't need to quarantine because they get their fish through a reputable koi dealer. Unfortunately, this does not guarantee safe fish. Even with the episodes that we've had in California, some of the most reputable dealers may have been implicated in this case. Unfortunately, we cannot give names, but it's very important that you ask them for specifics on how they quarantine their fish, how long are they kept, and at what temperature are they kept, most importantly. Ask to see the records of a fish's arrival. If that company refuses, you need to go somewhere else because they may be aware of KHV. It's been almost 17 years since we had our last major outbreak, but we are seeing it more and more that unfortunately either these cases aren't reported or only now are we starting to see cases that have been caught by veterinarians. So prevention is the only option for protection against KHV. There is no treatment available. There used to be a vaccine available, but unfortunately that is no longer the case. There just wasn't enough use of it, and the manufacturers thought it wasn't worth their while. Getting fish from a reputable koi dealer does not guarantee safe fish. You need to ask them for the specifics on their quarantine process. And if they do not share that information with you, it's time to go somewhere else. So all the good places, if they're willing to share their quarantine information, we're happy to discuss it with them and with potential buyers. So if you have any questions, please feel free to contact your local fish veterinarian. We will have listings at the end of this webinar. So moving on to how do I test my koi for KHV? So if you suspect or you just want to make sure your fish aren't infected, there are two options available. Two are through UC Davis, and another is available at the University of Georgia's Vet School. Antemortem testing done prior to death can be used with gill tissue. They look for a PCR testing for an active infection. There is a blood test as well that looks for antibodies that will detect exposure to KHV. So this could potentially isolate carriers. However, this test is not 100% accurate. We do see a few false positives. So really it has to be combined with the clinical signs that you are seeing at the time. Obviously, there are post-mortem, so after death testing available. However, the carcass must be fresh, and this is not a fish that has died overnight. So again, it's going to be a little hard to determine this if you're not too familiar with fish. So your veterinarian may be needed to determine the validity of the body that you have. With these tests, it's going to be the PCR test for an active infection, obviously if the fish died from KHV, and usually we will send gill, spleen, liver, and kidney tissues. If you are going to be doing antemortem tests on your fish, the testing must be performed by a licensed veterinarian. Whole fish can be sent to the lab independent of a veterinarian. You need to call the lab and make sure you understand exactly what they need on shipping and what needs to be determined as far as how long that fish has been dead if the samples are still viable. If you need to find a fish veterinarian for you, you can go through the American Association of Fish Veterinarians or the World Aquatic Veterinary Medical Association. Both of these have listings of all the fish veterinarians that are within their membership. If you are in California or Nevada, you're certainly welcome to call us. We cover pretty much half the state right now. If you are in Sacramento, you have UC Davis right there. They do offer house calls on weekends. San Diego, Dr. Todd Cecil is down there. And Bakersfield has Dr. Irene Yen. You can find all of their contact information online. We will be offering our spring pond special coming up. So this is very important to owners who are concerned about their fish health. This package deal includes water quality and fish physicals, and it will be a package deal of $289 with a slight mileage charge. We ask that you call to schedule. Our phone number is listed there and will be again on the last page. For more information about koi, we have our newest publication, Healthy Koi Made Easy. This is a great reference for all koi owners, enthusiasts, hobbyists. It's very easy to reference, and we have it broken up into great chapters on water quality and nutrition and disease. And yes, KHV is covered. We have it available in soft color, PDF, or Kindle. And we're doing a raffle for a free copy now because our 5th birthday is coming up in a couple days. Like I said previously, our next upcoming webinar will be on quarantine practices, which is very, very important for KHV. So we'll be going through the steps and how to build your own quarantine system and what you need to consider when building it. And if you are a fan of koi, we have another webinar on koi health and keeping. This is Tuesday, April 3rd, coming up next month. And if you need to see any of our other webinars, they're on our website there at that link. If you would like more information on KHV, I highly recommend this handout from the University of Florida. They have great fish vets down there who are handing out a lot of great information. Our contact information is there. If you have any questions about KHV, if you'd like us to send some free information, we have lots of handouts available on KHV and quarantine, pond maintenance, all that good stuff. So I am looking through the questions right now, and unfortunately it seems like a lot of people were having trouble with the GoToWebinar setup. So I'm sorry about that if people weren't able to log in. Like I said, this webinar will be available afterwards. It will be up on our YouTube page for anyone who wants any of this information. And does anybody else have any questions about KHV? All right, we got one question asking about a fish that was bought in the fall. Okay, yeah, so fish that might have been put into a pond during the fall, again, when it's colder, could persist through the winter. And since it's never going to really break that temperature threshold potentially, they might not see an outbreak of it until this spring. We are actually expecting a lot of this to be occurring. But yes, if you added a fish in say, the fall, and it's been doing okay, the temperature really hasn't broken that 60-degree mark yet, yes, you could potentially be looking at a KHV outbreak coming through when the temperatures warm up. So yes, unfortunately, that is an issue. Any more questions? If not, our website, we have a question box right there. So if you have any follow-up questions, please feel free to look there. All of this information on KHV will be posted on our website shortly. So thank you very much for joining us. I apologize to those of you who couldn't hear me. Hopefully we'll work out those bugs and we will make sure that everybody gets a recording. So thank you very much for joining us and have a lovely afternoon and evening.